Welcome to Ara's Nursing Zone. Modified Glasgow Coma Scale for Infants. The Glasgow Coma Scale, GCS, is used to describe the general level of consciousness in patients with traumatic brain injury, TBI, and to define broad categories of head injury. The GCS is divided into three categories: eye-opening, E, motor response, M, and verbal response, V. The score is determined by the sum of the score in each of the three categories, with a maximum score of 15 and a minimum score of 3, as follows. Eye-opening. Opens spontaneously, the score will be 4. Open in response to verbal stimuli, the score will be 3. Open in response to pain only, the score will be 2. If there is no response, the score will be 1. Next, verbal response. If coos and babbles present in infant, the score will be 5. If irritable cries present, the score will be 4. If the infant cries in response to pain, the score will be 3. If the infant moans in response to pain, the score will be 2. If no response in infant, the score will be 1. Next, motor response. If the infant moves spontaneously and purposefully, the score will be 6. If the infant withdraws to touch, the score will be 5. If the infant withdraws in response to pain, the score will be 4. If the baby responds to pain with decorticate posturing, the score will be 3. If the baby responds to pain decelerate posturing, the score will be 2. If there is no response, the score will be 1. Interpretation. Patients who are intubated are unable to speak, and their verbal score cannot be assessed. They are evaluated only based on eye-opening and motor scores, and the suffix T is added to their score to indicate intubation. In intubated patients, the maximum GCS score is 10T and the minimum score is 2T. The GCS is often used to help define the severity of TBI. Mild head injuries are generally defined as those associated with a GCS score of 13 to 15. And moderate head injuries are those associated with a GCS score of 9 to 12. A GCS score of 8 or less defines a severe head injury.